Hello, everyone, and welcome. I'm Tom Schumacher. I am a program director with the National Rural Health Resource Center. Thank you for joining us today to introduce the Rural Hospital Stabilization Program. The center is the nation's leading technical assistance and knowledge center focused on rural health. We directly support rural hospitals, clinics, state offices of rural health, and other rural health organizations with information, tools, and resources designed to help sustain access to health services in rural communities and improve the health of residents living there. Pictured here is our stabilization team. As I said, my name is Tom Schumacher. I am the program director, currently residing in Wisconsin. And I basically oversee the operations of the team, the budget, and the strategic development of the stabilization program. And now I'll hand it off to Karen Lund.
Thanks, Tom. I am Karen Lund. I'm a lead program specialist with the stabilization team. I focus most of my time on the application and selection process, as well as the community engagement champion pieces. I also want to introduce Mike Rowland. He is also a lead program specialist who is not able to join us today, and he will work with the equipment portions of this program. Nicole?
Hi, I'm Nicole Clement. I'm a senior program specialist here at the center. I'll oversee a cohort of 4 of the 8 hospitals that are selected and also lead the focus on education and promotion of the program. Tabitha Stone, to the right of my picture, she is also a program specialist and will help oversee the other 4 hospitals. Daisha, you want to introduce yourself?
Hi again, guys. My name is Daisha Capers. I'm a program coordinator here with the stabilization team. I help with scheduling, and I'll pass it over to you again, Tom.
Thank you, Daisha. The purpose of this program, the agenda that we're going to review today is the purpose and the overview of the program services, the participation expectations, and the eligibility, as well as the application and selection process. The Rural Hospital Stabilization Program is funded by the Federal Office of Rural Health Policy. Our program coordinator is Christy Edwards. And now I'm going to allow Christy to say a few words of her own. Christy, are you there?
Good afternoon, everyone. I'm Christy Edwards, and I am the program coordinator for the Rural Hospital Stabilization Program here at the Federal Office of Rural Health Policy. I lead the administration of this program as a part of our suite of rural hospital technical assistance programs. Through the administration of our many hospital TA programs, we recognize a need for rural hospitals to enhance or expand the services they provide to drive increased patient volume, which leads to long-term financial sustainability and provides access to high-quality healthcare in rural communities. With the fiscal year 2024 budget, we received support for the Rural Hospital Stabilization Program that was proposed in the President's budget. That support continues in the 2025 fiscal year, and I would like to share a thank you to Congress for recognizing the needs of rural hospitals and providing funding to address these needs. Our goal with this program is to stand up a technical assistance program with a national scope that provides hospitals with consultation services from the nation's top experts on rural hospital finance and quality at no cost to the hospital. Experts will identify clinical areas where expansion would meet local medical need, help keep healthcare services available locally, and improve hospital finances and operations. All of this will be done in collaboration with the National Rural Health Resource Center, who administers the program on behalf of the Federal Office of Rural Health Policy. Shortly, you will hear more from the team at the center on how this program can support your hospital in expanding or adding new services to best meet the needs of your community and also to improve the financial sustainability of your hospital. Before I turn it over to the team at the National Rural Health Resource Center to talk about how to access these services, I'll put a plug in to reach out to my team if you'd like to learn more about the full suite of rural hospital TA programs that our office administers. You can connect with us through the inbox listed on the slide at ruralhospitals@hrsa.gov. Thank you for your interest in this exciting program. And I will turn it back over to Tom now. Thank you.
Thank you, Christy. The Rural Hospital Stabilization Program aims to improve healthcare in rural areas by keeping healthcare services available locally. The program provides in-depth technical assistance to selected hospitals to help leaders improve financial position and increase operational efficiencies, grow current services, potentially add new ones, all in order to increase patient volume and hopefully improve revenue, as well as engage the community to support the hospital and promote hospital services to increase utilization of those services. This program aims to increase the volume and revenue to improve their financial stability in rural hospitals that are at mid to high financial risk, or may be experiencing lower diminishing patient volumes and may have limited access to resources. The center applies a comprehensive technical assistance approach to system development that enhances stability. The center's internal subject matter experts, along with our network of nationally known rural hospital technical experts, provide a wide range of services such as financial analysis, operational assessments, education, marketing, community engagement that all financially stabilize rural hospitals with limited access to these resources. Our network of hospital experts include Forvis Mazars, I. Bailey, Stroudwater Associates, and Stratus Health. The National Opinion Research Center and Dr. Eric Scorsoni also support our evaluation process. On to benefits of participation. The center's TA approach builds the hospital's viability. The program meets the clinical needs of rural communities by stabilizing rural hospitals through improving financial and operational performance, expanding existing services, and adding new service lines potentially, all for providing support for the initial operating and equipment costs to help build new service lines or expand existing service lines. We also help in engaging the community with marketing of locally available healthcare services that meet your needs. And now I'll hand it off to Nicole.
So services begin with the financial and operational assessment and then an action planning session. The FOA is foundational to performance improvement and focuses on expanding existing and new services. A feasibility and needs assessment support operational decision-making for adding new services. Leaders receive direct assistance operationalizing services, supporting equipment, marketing services, and engaging the community. The center staff will guide hospitals through this entire process. The purpose of the FOA specifically is to assess hospital-wide operations at the department level. The FOA determines causes for financial distress, evaluates gaps in clinical services, and recommends operational growth opportunities based on industry-accepted best practices. Services include a bench analysis data request, interviews with key leaders, and a full day on-site report out and action planning session, where the hospital team establishes planning priorities to grow services and identify a potential new service line opportunity. This list summarizes I think we skipped a slide. Yep. This list summarizes the FOA scope of services. As you can see, the FOA is comprehensive, so I'll give you a minute or two to just look over this list. Go ahead, Daisha. Next slide. Next, a high-level feasibility assessment is performed to evaluate the community's capacity to support a new service and determine if it's reasonable to offer that service. The feasibility provides leaders with operational decision-making information to evaluate whether they should move forward with the needs assessment. Once the leaders make a go decision, then the needs assessment can be initiated. In some cases, a hospital may focus on growing a currently existing service. In these situations, services may include a feasibility or other analysis to support decision-making, such as a service line profitability analysis. The needs assessment includes on-site clinical observations and virtual interviews with key hospital personnel to identify gaps between available and needed resources such as staffing, equipment, supplies, facility requirements, and telehealth capacity. The needs assessment includes a virtual action planning session to build out steps to operationalize the new service and support the justification of equipment needs. After the needs assessment action plan is developed, back one slide, please. Thank you. After the needs assessment action plan is developed, then regularly scheduled implementation coaching with Stratus Health will occur. Implementation coaching calls assist leaders with operationalizing new services. Guidance is given on developing policies and procedures, developing staffing and clinical workflows as examples. After a hospital completes the FOA, feasibility and needs assessment and has started implementing services, the center helps the hospital to evaluate appropriate equipment based on identified needs and evidence-based care. Services could include vendor demonstration, purchasing steps, and other needed support to ensure equipment choices align with the hospital's service line goals. The program obligates funding for initial operations and equipment costs for service line development. The program also assists leaders with promoting services and provides staff education. The program will support hospitals with approximately 0.5 FTE to support a community engagement champion to market hospital services to the local community for approximately a year. Community engagement is essential to the hospital's financial viability because it builds broad public awareness of available services for the purpose of increasing patient volume and growing revenue. Virtual staff training and peer-to-peer education provided through hospital learning collaboratives builds internal capacity that enhances sustainability of post-project performance gains. This Gantt chart illustrates how each service builds internal capacity to enhance the hospital's stability. It also provides a glimpse of how these services are positioned through the program to support hospitals in sustaining those performance gains. The chart represents an average time for a hospital moving through the program.
Of the significant amount of funding that's obligated to our selected hospitals for on-site technical assistance, strong leadership is required to ensure that the hospital benefits from program services and produces measurable outcomes. That is why it is essential that the board of directors support the executive leadership and management teams in all program areas. Executive leadership and management teams are expected to be engaged in all facets of the program, and the CEO must commit the necessary time for the executive and management teams to be actively involved in these activities. The CEO is expected to lead the hospital through the program. However, a contact person may be designated to coordinate communications and keep the activities on track. Both the board chair and the CEO of the selected hospitals are required to sign the Memorandum of Understanding to participate in the program. To be eligible to apply for the stabilization program, hospitals must meet HRSA's definition of rural, and you can see some links here that will help determine your eligibility. Hospitals designated as critical access, PPS, rural emergency, and tribal hospitals located in rural areas are eligible to apply. And as I mentioned, you can learn more about our eligibility on the website links here. Applications are accepted on a rolling basis, and we are working to identify a new cohort of hospitals back in our upcoming October calendar year. The application process consists of an easy online application that gathers contact and baseline information about the hospital and how the leader envisions the program assisting their organization. The application requires the candidate's acknowledgement of the program expectations and, if selected to participate in the program, the requirement for the board of directors and executive leadership to sign that memorandum of understanding I just mentioned. Our online application aims to screen and identify applicants that fit the program technical assistance model and could benefit from our services. Identified applicants may be asked to provide some additional information about their governance, key financial indicators, utilization of your hospital services, and patient volume following the web application to further support decision-making. based on the additional information gathered, the hospital chief executive officer of identified applicant hospitals are invited for an application review call to complete the application process. This call gathers more details on the hospital's financial status and patient volumes. This application review call provides leaders an opportunity to learn more about our program through a one-on-one conversation and ask questions as well. Leaders will gain a greater understanding of our program purpose, benefits, services, and expectations. And more importantly, it allows the leaders to make an informed decision as to whether the program is also a good fit for the hospital. Submission of an application does not guarantee that a hospital will be selected for the program. Our first cohort had 113 applications, and we were able to select 8 hospitals. Come October, we will also be selecting 8 hospitals in that cohort. Up to 8 hospitals, as I mentioned, will be identified for that in-depth on-site technical assistance services to improve performance and grow currently existing services and add a new service line to expand access to care. Applications are evaluated based on several considerations that you can see here, defining how well each applicant hospital's needs coincide with our program purpose, the commitment of the organization's leadership to participate fully in the program, and some other considerations that are not limited to the support of the board of directors or the management company, the readiness of the organization to undertake a large project such as this, the capacity of the staff that are going to be supporting this work, and the alignment between the hospital needs and the program services. Lastly, participation in other similar programs that provide financial and operational assessments is not allowed. We cannot have participation in 2 types of programs that provide the same type of information, because we know that we have a lot of hospitals who need this type of support. State partners may be asked for their input because of the level of engagement in state programs can also predict a hospital's involvement in these types of new programs. Based on our first round of applications from the spring, we want to highlight some things that we want you to consider before applying. The program cannot fund standalone equipment purchases, building repairs, or other items unrelated to the new service line that is identified through the financial and operational assessment process. EHR transitions, while they are wonderful, that and major projects might impede your program participation. So we do want you to consider waiting to apply if you have large projects or EHR transitions taking place at the time that was shown on the Gantt calendar. Also, as I mentioned, you cannot participate in the Rural Hospital Stabilization Program while participating in a similar technical assistance program. And lastly here, if your hospital does not have a permanent CEO, we would ask you to consider applying at a later time until that role is permanently filled. In our first round of hospital selections, we had an abundance of applicant hospitals. So these are some things we wanted to suggest if you are considering applying for this next cohort of hospitals, a part of our program, to ensure that your hospital can stand out and it will give you the strongest score possible through the full application selection process. Plan thoughtful answers to the narrative questions that you can see on the web online application, and give us as much specific information as possible. For the survey, please gather financial data for your hospital that is as current and as accurate as possible. If you are missing data, please work to find the answers to that data, and rather than leaving any areas blank. We cannot score an incomplete application. Also, please know your hospital and its needs and how that relates to the services that we can provide in the Rural Hospital Stabilization Program. We cannot build a new hospital, for example. So please take a look at our website, see what technical services are available, and see how that relates to the needs of your organization. And lastly, as I mentioned with the application review call, that is a one-on-one call between us and the CEO of the hospital. A set of questions is provided prior to that call, and we really hope that you would take that set of questions to prepare and think through thoughtful responses for your hospital. Applicant hospitals that are not selected to participate in the current program cycle can be considered for future program cycles. Up to 15 hospitals that are not selected for the on-site in-depth technical assistance will also be invited to participate in a learning collaborative, which will help them to be more competitive for future years. For hospitals interested in participating, we encourage you to apply early, considering the timelines that you can see here on this slide. While our applications are rolling, we do have to identify a cutoff date, and you can see August 20th is going to be that cutoff date for accepting applications to kick off in October. Hospitals will be notified of their inclusion into the program at the beginning of October, with a kickoff webinar later that month for our 8 selected hospitals. Please consider your hospital's projects and initiatives in light of this timeline. We want to thank you for taking the time to listen today about our program. If you have additional questions, please check out our frequently asked questions on our website. Additionally, you can contact us at the stabilization email address on this slide. And we also have the chat or the Q&A box activated to review any questions that come in from the audience. And I'm going to turn it over to Alyssa to let us know what questions we've got.